Hello everyone. Today we have with us Dr. Ravindra Sonawane. Welcome Dr. Ravindra Sonawane. He is the professor and head of department and the PG coordinator at the Dr. Vasantrao Pawar Medical College in Nashik. Welcome sir. Thank you for taking time to be with us to discuss on some of the important aspects of the influenza vaccine. Let's start at the beginning, Dr. Ravindra. What do you think is the importance of the influenza vaccine?
Okay. So, the importance of influenza vaccine is especially in younger children, especially under the 5 years, and in that also, especially under 2 years, they have a higher complication rate due to small airways and developing immunity. So, they may develop respiratory problems like pneumonia, otitis media, then hyperreactive airway disease, then neurological complication. This influenza can become a viral trigger for the acute encephalopathy, febrile seizures, and even cardiovascular complication like myocarditis. Now, this can cause influenza can cause secondary infections. It invades the respiratory epithelium, so patient become immunocompromised and get infected with the secondary infection like a staphylococcal or pneumococcal pneumonia.
You mentioned now about the problems which can occur following influenza infections. So that's a very, very important point. So which goes to show that there is a higher morbidity as well as probably a higher mortality in the younger ages, and hence vaccination is probably a preventive method of taking care of these children. So what vaccines do we have now in India?
Yes, now in India we are having the trivalent vaccine, especially. Previously it was a quadrivalent, but now it is a trivalent strain. This trivalent strain containing influenza A strain, that is AH1N1, then AH3N2, and B Victoria. B Yamagata is now phased out. There is an absence of circulation of this B Yamagata since March 2020. So answer is trivalent strain of influenza vaccine, and especially killed vaccine.
Right. So I think you have given an important point. The trivalent vaccine of influenza, I think that's the one which is currently available. Now, what's the best time to give this vaccine?
Yes, very good question. So now the India is having a different ecological conditions. So it has a different influenza peaks. So now, especially in the central area or including Maharashtra, the monsoon season is around the July to August. So best time is to give before the monsoon season, that is the April-May, because antibodies take us time to develop. So best time is April-May, and especially southern hemisphere formulation can be used in central India including Maharashtra, but in North India, especially this Kashmir or in even Kerala and Tamil Nadu, the monsoon peak is around the November to February. So the best period is the September. Before the monsoon season, especially Kerala, Tamil Nadu or Kashmir, and the here northern hemisphere formulation can be used. But if that optimal window is borne out, you can give a vaccine containing any strain that is recent one.
Right. So that's a very important point that you mentioned, the timing as well as the strain. So not the southern hemisphere is preferred for the country, with the exceptions of the 3 states that you mentioned. But you also mentioned that at any point in time, please do not wait for the particular state. Give whatever is available, the latest available vaccines. So thank you so much for emphasizing on this. Having said that, sometimes parents are a little bit worried. We have doubts regarding the safety of this vaccine. So any comments on that, Doctor?
So it is very absolutely safe, because all over the globe this vaccine is used since many decades and without the major side effects. Only some mild side effects like pain, erythema, induration, that can be seen in 50 to 20% of patient, and that get resolved by in within 24 to 48 hours. And about the systemic reactions like mild fever, irritability, myalgia, that can happen in very trivial patients. And yes, about the Guillain-Barré syndrome, it can occur in 1 to 2 patients so after 1 million doses, a very rare complication. Influenza disease can cause multiple times GBS than the influenza vaccination. And also one point to be added, in patient of egg allergy, this vaccine is absolutely safe because its overall albumin content is very low, and nowadays the chicken embryonated egg that was used previously for this vaccine, now modern cell culture vaccines are used for the influenza strain, so absolutely safe. And what is the absolute contraindication? Hypersensitivity to the or anaphylactic reaction to the previous component of the this influenza vaccine. That is only the absolute contraindication. And one of the precaution or some relative contraindication you can say ki Guillain-Barré syndrome history within the 6 weeks of influenza vaccine. Otherwise, this influenza vaccine is absolutely safe.
Right. So very well elaborated by you that the vaccine is extremely safe. Now, you talked about the disease being more severe in the younger ages, especially below 5 to 6 years. So, doctor, I have a question now. Is there any role for this influenza vaccine in children above the age of 6 years? Any specific groups?
Yes, above the age of 6 years, there are some high risk groups. For example, cardiovascular group, congenital heart disease, then chronic cardiac disease like a cardiomyopathy, then the neurological disease like a cerebral palsy, neuromuscular disorders, then epileptic disorders with developmental disability, then the chronic kidney disease, chronic liver disease, metabolic diseases like type 1 insulin diabetes, mellitus, then the immunodeficiency patient with primary immunodeficiency or the on the immunosuppressant or malignancy or the post transplant patients. These all have a all are immunocompromised. In such a conditions, this influenza vaccine should be used. These are all the high risk categories.
Right. So very well elaborated. I think there is definitely a role also in the chronic lung diseases and asthmatic children. Yes, you have to give the vaccine, and as you have mentioned, absolutely safe. Before we close this discussion, Dr. Sonawane, any role of the influenza vaccine for us, the healthcare workers?
Yes, definitely. If I am giving my example, I am using this influenza vaccine actually every 6 months because the immunity by the after giving influenza vaccine it's generally wanes for the 6 to 12 months. And this influenza vaccine is a very notorious influenza strain. It is having antigenic shift and antigenic drift is creating problem. So health workers are also the high risk category because we are seeing many patients of the influenza. So we should give vaccine to us and our healthcare workers, paramedical staffs, our UG students, PG students, and all staff working in the hospital compulsory every year.
Thank you so much, Dr. Sonawane. Thank you for elaborating on these important points which come up usually in our day-to-day practice. So thank you so much. It's been a pleasure having you. Thank you.